Okay, let's go. Welcome to everybody. In the next 1 hour, we will discuss some results of some sub-project of Spoke 2. My brief introduction is only to illustrate the organization of the Spoke 2, which is a spoke which deals with predictive and preventive medicine in different clinical settings. So we have organized all the sub-project in, as you can see in the slides, in 5 the area of public health medicine, primary prevention and early diagnosis, advanced technologies and biomarkers for preventive medicine, alternative predictive methods to animal testing, and drug design and development of innovative treatments for preventive medicine. And so the spoke includes 24 sub-projects, as you can see, 5 for the first area, public health medicine, 2 sub-projects for primary prevention and early diagnosis, 10 for the area of advanced biomarkers, divided in biomarkers for response to therapy and biomarkers of disease severity or progression of disease, 2 sub-projects for in the area of alternative methods to animal testing, and 5 again for drug design, discovery and development of innovative treatment. The time in this next hour we will discuss the following projects. For the area of public health medicine, Professoressa Baccini, which is the PI of this project, and Professoressa Becchini, and then we will and then we will discuss these 2 sub-projects, which both of these projects have the same focus, male infertility from a laboratory point of view, Professoressa Baldi for method of fertility preservation in prepuberal males, and from a clinical point of view, Professoressa Vignozzi for the evaluation of new predictive biomarkers in the development of a healthcare system for prevention of male infertility. And okay, I can do. And then for the area of biomarkers for disease progression, we will discuss the results on multiple sclerosis from the research group led by Professoressa Amato. And finally, innovative treatments to improve preventive medicine from the group of Professor Baldini.